Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending Thursday, February 4th, 2021. This week, I'm going to answer three questions. The one that I answer every week, which is how is the pandemic progressing globally in the U.S. and in our region? And then I'm going to answer two questions that are interrelated that have come up quite a bit. If I have had COVID-19, do I need to be vaccinated? And if I've been vaccinated or if I've had COVID-19, do I still need to wear a mask, avoid crowds, social distance, and so on? So let's address these questions. First of all, globally, the pandemic has now had over 2,280,000 deaths, almost an incomprehensible 100 million known cases, and a 4.8% increase over last week to week, in the total number of deaths. As I've pointed out before, early in the pandemic, the week-to-week rate was very high. Then in September, October, it dropped down quite a bit, but in the last few months has been running 4.5% to 5%. This tells us that the pandemic is not slowing down globally. And if the 4.8% week-to-week increase continues, we'll get to 3 million deaths worldwide in about 6 weeks. The distribution of cases remains pretty much the same as it has been. It started in Asia, then it really hit Europe in the springtime. The summertime was mostly the Americas. Then the last few months, we've just seen this surge in both Europe and the Americas, which now appears to be slowing down a little bit. In terms of the United States, we've had 462,000 deaths, almost 500,000 deaths. 23,000 deaths last week alone. That's about 2 deaths a minute and a 5% week-to-week increase. So we're growing at about the same percent, maybe slightly more than the world is overall. We saw this same pattern where after rapid growth, when the pandemic first appeared, it then slowed down. And by October, September, it was pretty slow, but has been picking up and has been at about 5% for the last couple of months. At this rate, we'll get to 500,000 deaths in about 10 days. If you look nationally, this is where all the reported cases were. And you remember the pandemic started in the urban areas, the Northeast, the Southwest, and the Northwest. And then it sort of spread around. But it's interesting to see this is where the darker counties where most of the cases have been. And this is interesting to look at it this way. This is the last 2 weeks. And for those of you who've been following this looks pretty good. So what I did, I went ahead and got the images from August 4th onward. So this is the way the U.S. looked in early August. So again, remember the pandemic starts in March, April, May in the Northeast and the Southwest. By early August, it's predominantly hitting us here in the Southeast. Then in September 1st, it starts to look like it's moving north. October 1st, we see this really big hit in the Plains states. And then in November, then December, it's going everywhere. And then January, it's starting to slow down, though still heavily hitting Tennessee. And then this month, slowing down even further. So for the first time, our region doesn't look particularly bad in terms of cases in the last 2 weeks. We are still seeing deaths in our region. If you look at the states that we consider regional partners, again, the number of deaths is quite different, but in part that's because of the population. But if you look at deaths per million, South Carolina and Tennessee are still quite a ways ahead of the others. In terms of week-to-week change, again, this is the first time that Tennessee has actually been the best of all of these. So the pandemic is still evolving and growing nationally, but it seems to be slowing down, at least in terms of deaths. In Ballard Health's 21 county area, we've had 1,659 deaths since the pandemic started, 7% increase in the past week, which is slightly more than Tennessee overall, but certainly lower than it has been. And at this rate, we'll hit 2,000 deaths in about 3 weeks. So the pandemic is apparently slowing down in our country, but still growing. We're certainly not out of the woods yet, but maybe there's some light at the end of the tunnel, at least temporarily. So this brings us to one of the factors that can impact the future of the pandemic, and that's vaccinations and social distancing and masking. And this question comes up quite a bit, which is, if I've had COVID-19, do I need to be vaccinated? And if I've been vaccinated or have the disease, do I still have to do all these silly things like wear masks, social distance, and so on? And I answer both of these questions together because they're really built on the same concept, which is, are you immune if you've had COVID-19 or if you've been vaccinated? And so most people who've had the disease appear to be immune, at least for some time. According to the National Institutes of Health, antibodies are found in 98% of people 1 month after symptom onset. And then these numbers remain pretty stable for 6 to 8 months. And 95% of people have 3 out of 5 immune system components up to 8 months after infection. So that's good news. It tells us that most, but not all people who've been sick will be immune. And we see the same thing with vaccination. It appears that most people who've been vaccinated are also immune. In the initial study from the CDC, from the FDA, the emergency use authorization was based on 36,000 participants, of whom about half got the vaccine, half got placebo. And the vaccine was 95% effective in preventing COVID-19 among the clinical trial participants. So good, in the sense we have immunity if you get the disease and immunity if you get the vaccine, but not total, right? 98%, 95%, that's good, but it's not total. And both CDC and WHO have reported cases of people who have become infected a second time, not a lot, but a few. We do know that it is not uncommon for immunity to wane over time. And there are some diseases for which lifelong immunity develops after infection or vaccination, and others for which recurrent infection is not uncommon. And we don't yet know which pattern COVID-19 is going to have. We do suspect that immunity will be less robust in the elderly for COVID-19. Of course, as they're one of the highest risk groups, that's of concern to us. And we know that the virus is mutating, and we're not quite sure what that means for long-term immunity. Right now, the best data that I've seen suggests that the vaccine is effective against these variants, but we don't know how long that will last. And that makes it even more important that we take the actions that we can to avoid further spreading. And there's also the possibility that even if someone is immune, they may be able to spread the disease to others. There are some reports of diseases where someone is not symptomatic themselves, but can certainly spread the disease to others. We don't know if that's the case, but those are possibilities. So all that comes together and you say, well, should someone who is recovered from COVID still be vaccinated? And according to the CDC, the answer is yes. Due to the severe health risks associated and the fact that reinfection with COVID-19 is possible, you should be vaccinated regardless of whether you've had COVID-19. They say that they don't know how long immunity will last, and both natural immunity and vaccine immunity need to be studied over time. We simply haven't had enough time to know. So at this point, the CDC says, yes, if you've been sick, you should be vaccinated. You should talk to your physician, though, because there are some particular recommendations regarding how you were treated and how long after disease you should be vaccinated. But the answer is yes. And then the ultimate question is, does someone who need to wear a mask and avoid close contact and so on, if they've been vaccinated or if they've had chronic disease? And according to the CDC, the answer is yes. They say not enough information is currently available to stop recommending that people wear masks, avoid contact to prevent the spread. And while we are learning more about the vaccine in real world conditions, it is important for everyone to continue to do the things that we've been talking about for months. Wear a mask, stay away from people and minimize the amount of time you're close, avoid crowds, avoid poorly ventilated areas, and wash your hands often. So the pandemic is still progressing globally in the US and in our region, though it may be slowing down a bit. And if you've had COVID, yes, you do need to be vaccinated. And if you've been vaccinated or have COVID-19 or had the disease, you should still wear masks, social distance, avoid crowds, and so on. As I say, these are questions that have come in. There's a great deal more information about COVID-19 on the College of Public Health website. If you'd like to be added to our mailing list or know someone that would, please contact us and let us know. Thanks, as always, to Melissa White for helping to collate data and Dara Young for editing, producing, and posting this video. And as you can see, I'm trying to answer your questions. So if you have any particular questions for me on COVID-19 or what I've said in this video, please let me know. I look forward to hearing from you. Until then, please be well.